Next speaker is Dr. Kavitha. She'll enlighten us on cover-uncover test. Now, this is one testing screen which I always forget. So I always love to listen, actually. And squint is something that is beyond me. So
I thank KSOS for this opportunity. Just the first slide is on the prerequisites for cover-uncover test. I just made a mnemonic like A, B, C, D. The patient should be able to understand what you're going to do and be attentive, be cooperative, and able to fixate a target both distance and near. And there should be good extraocular movements which should be full. And the equipment is very simple. We need a torchlight, occluder, both dark and translucent, which is called the Spillman occluder, which comes in combination. Now, earlier we used to get it as a single one. And a target could be a Snellen chart and a near chart, or some kind of a toy which is attractive to the child. And prism bar and loose prisms. In this test, one thing we have to remember is cover test is to understand the other eye which is uncovered, what is happening to that. So first is whether there is a refixation movement. Second, if the direction of the refixation movement and how fast it is refixating. So likewise, cover, uncover, we will look at the eye which is under the cover and what exactly is happening. And again, refixation movement after you remove the cover under the eye that is under cover, and the direction and the speed at which it is moving. And then the third thing is alternate cover test. So in the first two, we are looking at manifest deviation. And the second is alternate cover test. Actually, we are breaking down the fusion. Therefore, you're eliciting latent deviation along with manifest deviation. You'll get the total deviation. Sometimes the eyes may look straight, but then you do alternate cover test. You pick up the fovea. So that is latent deviation. So in all this video, I won't be explaining repeatedly because of lack of time. So now in this child, the eye appears that there is left eye squint. So I'm doing alternate cover test, but there's no particular refixation movement in either eye. So this is the first thing that we have to rule out is pseudostrabismus. Likewise in this child, the eyes are appearing straight, but now I'll do cover the right eye. There's no deviation in left eye, but there is deviation in the right eye. There's a refixation movement. So when you do alternate cover test, there's repeated refixation movement. So this is phoria. In this boy, there is esotropia. Eye is already turned in. Now you do alternate cover test. And keep examining, there's an outward deviation and each eye is fixating relatively okay. But there's relative dominance of the right eye because left eye is taking up fixation at a slower speed. So all the tests are done for distance as well as near target. I'm using a near target here. Now the first thing how to neutralize is I use a bar to neutralize, but this comes only about 35 prisms. So I use 2 loose prisms to understand where exactly it's getting neutralized or there is no refixation movement. So I'm using 2 loose prisms. It's slightly difficult, but then you can get this perfect position of the prisms by practice. Distance and near it is measured. So the esotropia is getting neutralized at 75 prisms. Now with the glasses, if the patient is wearing, this test is done once again for distance and near. And it's getting neutralized at a lesser prisms, that is about 45. So there's a difference of 30 prisms, which is covered up by the spectacles that I have given. What is this now? Patient is wearing specs, but there is a movement in the opposite direction. So this is 55 prisms, so it's over, So this is another patient with esotropia. She wears glasses and it appears as if the eyes are straight. It doesn't end here. You do alternate cover test and you see that the right eye is deviating out. So there is some residual squint or esotropia. This is partially accommodative esotropia. I think this is... yet another one which I want to show is what really is happening in the left eye is this minimal nystagmus And after doing alternate cover test, there's exaggerated nystagmus. So there is manifest as well as latent nystagmus, and also you can appreciate that there is slight poor fixation movement in the right eye, which indicates there is lesser vision as compared to, okay, this video you can see that right eye is deviating, moving down, that is DVD. This is the last. You can see that the right eye is coming down and alternatively the left eye is moving up. So this is alternate hypertropia, which you can see that it's slightly lesser in the right gaze. Now I'm changing to left side and it is slightly increased on the left gaze. This is the Park 3-step test for hypertropia. And then you do the third step is the tilt, where you can see that obviously the right hypertropia is increased much more than in the gazes. So we can see, these are the birds in my house. I just picked up this video where there's these feeding alternatively, something like our alternate cover test. Thank you.
Thank you so much, madam, for that
Thank you.
excellent video presentation, clearly demonstrating each. I always have a difficulty when there is both horizontal and vertical squint altogether, when utilizing with the prisms, how to go about with that.
Yeah, you keep the horizontal, loose prisms will be better then. You need an assistant as well to hold the position of the head and make sure that the patient is resting well at the back. So invariably they lift and then the position is not at primary position. Of course, all these are done in all the 9 gazes. You keep the loose prisms behind the vertical component depending on the direction. If there is hypertropia, you use roughly about 10 to 12 prisms. That is the routine prism diopters that we encounter. So you keep it behind the horizontally placed loose prism. Then hold it together and then you can do the alternate cover test.
Okay.
That's it.
Thank you.
Thank you.